Okay, we have gone live, so we are waiting for you guys to get on. I'm very excited about this talk today. Once you jump on, would you find the chat box and just let us know how old your children are, if you have any questions already about chiropractic care. And we're going to get into quite a few things, and we're glad you're here. So we'll get started in just a little bit, but definitely find the chat box. Let us know about your kiddos' ages, any questions you have, and we'll get started with our conversation in just a minute. So I'm going to pull up the chat for us. Okay, waiting for everybody to get on. Just give you a couple minutes and then we'll get started. I know this is kind of an odd time in the middle of the day, but everybody's so busy. Hopefully you can catch this recording later if you're not here with us live. Thank you for coming out to the Shepherd Studio. It's a glorious day. Last night I didn't know what we were going to have out here.
I'm not sure if you got storms blowing through this morning, so I'm glad there's not trees falling down
Yes,
everywhere.
The neighborhood definitely has trees down, and I was praying over all of this and the people, and our little ones came running down thinking the windows were going to break, so thankfully that was brief. Yes, so we are in good shape to get started here in just a minute. Everybody, please find the chat. Let us know how old your kids are, and if you have any questions getting started out of the gate. I know chiropractic for babies certainly wasn't anything I had even on my radar for the first 3 out of 4, at least. So I'm glad you're here. I know you're passionate about this topic.
I'm ready to get going. It's exciting because, like you said, most people don't know, and it's a completely foreign topic for them to go. And we even get crazy looks. Why? What? What do you say? Take my bait? Why? No. But you also think about chiropractic. I had this talk last night with a parent. You think chiropractic, what do you think about? And he instantly goes, back cracking. I said, yep.
Yeah.
I said, well, why would you get your back cracked? He goes, because pain. I said, so if you are thinking chiropractors are back crackers just for pain, why in the world would you bring your baby in to see a chiropractor? So there's a little more to it. And once we got done talking, he started nodding. You know when someone gets it, because they start nodding with you on the edge of their seat. They're like, yeah. So by the end of it, it was nice, but it just takes some time and a little more education as far as what chiropractic, especially specific types of chiropractic, are, as opposed to if you're in pain, go see a chiropractor and crack you.
It's almost like it's a little late at this point. Okay. All right. Well, Dr. Jason, thank you for being here. Tell us, why in the world did you become a chiropractor in the first place?
Wow. So way back when I was an undergrad, I actually wasn't sure what I wanted to do, something in the health field, and then I kind of wanted to be a teacher. In fact, when I was on breaks from undergrad, I would go back and visit my 5th grade teacher when I was back home, and we would chat about different things. So I always knew that I wanted to do something in health or something with people. I come from a large family, and thought, how cool would it be to make a difference or be that person? Everybody remembers one of their teachers, right? You could probably remember their name and what they even look like. So I was thinking, how cool is that to be that person for someone else? And she convinced me not to be. She goes, I don't think that you should. She goes, I think you'd be great, but all of the hopes and dreams and things that you want to do and experiences you want to have, I just don't think that. I think at the end of your life you'd go, oh man, I missed out on stuff. I think you'd be great at it, but maybe think about something else.
So you're teaching now. I can tell you teach all the time. Every time you talk to someone, I'm kind of the same way.
Yeah. Oh, I picked up on that from you for sure. Every time that there's a little window, it's like, oh yeah, this, and it's because of this, and I'm like, yeah, let's do it. Yeah, tell them, let's get it.
Connecting the pieces, looking for the root cause.
Right. So fast forward, I'm an undergrad, I get in a car accident, and I go see a chiropractor because aches, pains, back cracking, that's what you go see a chiropractor for. Neck pain, back pain, car accidents. So I headed off with this chiropractor who's a complete smart aleck, just like I was. I was 20 or 21 years old, and I thought I knew everything that there was to know about life, which I think every 20 or 21-year-old does. And we started talking about life, and he goes, what do you actually want to do? So I told him, what I thought. And he goes, if you really want to make a difference, you got to be a chiropractor. And I thought, funny. So I understand you probably help people get out of pain. You help them get back to work. You help do all that. That's awesome. But I mean, I want to make a real difference. And he goes, you have no idea what you're talking about. Why don't you come back next week and shadow for a couple hours, and you can see. So I did, thinking that, why am I even doing this? I'm really just doing it because I like the guy. And for those 2 hours, which ended up turning into me interning and then working there for free. I mean, that's how much I love that stuff. Is was me just willing to do that, or him just not paying you. I was like, all right, I'll still come in anyway. He was had to kick me out. But what I found that day was moms came in for pregnancy issues while they were pregnant, just to have easier labor. We had people come in that couldn't get pregnant. I say we, like I was part of that. I was just observing.
Yeah.
That couldn't get pregnant, that now there were kiddos and families that came in with asthma and allergy problems that were better. There were people with blood pressure issues and people with aches and pains and different neural problems. And at the end of it, I thought, I know what happened. You told people I was coming, and you set them up. And he goes, I told you, you had no idea. He said at that point, I said, what kind of voodoo is this? How are people getting better, healthier, and living better lives from getting their backs cracked? And he goes, I told you have no idea what you're talking about. He said, God made the body, God heals the body. The chiropractor's job is to remove the interference and get the hell out of the way so that the body can do what it was designed to do. And I thought, I can get on board with that. I can do that. So then from that moment is when I started shadowing 1 day a week, then 2 days a week, then every day after school. I even was working nights at a Home Depot, stocking shelves, going to school, working for him, still not getting paid. Well, it was free labor, goodness gracious. But I just loved it, every bit of it. And so that from then on, I changed everything that I thought that I wanted to do. I thought I had to be a chiropractor. And that led me to the chiropractic school.
Nice. Ooh, the wind's getting a little loud. I'm going to close the doors here. Pardon me, folks. Sorry about that, y'all. We had like a near hurricane last night, and I thought it was finished. Okay, so now fast forward to now you're not just a regular chiropractor. Now you've done additional training, and you think there's more to it.
Right. So now
regular chiropractor.
Yeah.
You probably still do some regular chiropractic and this neurotonal, you call it.
We do. So we do some more traditional type of chiropractic where we will give some manual adjustments if needed, based on our neuro scans, and we can get into that if we have time. Just helping us be real specific as far as what the body needs. Each person's different. You can't give every person the same adjustment that you would for everybody. That just doesn't make sense. So digging a little bit deeper into chiropractic and the nervous system, we've become a neurotonal type of chiropractic office, which really just says the nervous system controls and coordinates every single part of your body. We know that. That's how the good Lord created the body, in fact. It's the central nervous system. It even says in Grey's Anatomy, I always joke and say that, not the TV show, but the Grey's Anatomy, the actual textbook says that the central nervous system controls and coordinates every single part of the body. So it's the master controller. If you have a master controller of the entire body, why not check that system and see how well it's working so that everything else has better communication, better connection, and works to its highest possible potential? So that being said, way different checking and analyzing and adjusting for nervous system, for a neurotonal type of adjustment for the health of the nervous system, as opposed to let's get this joint moving and keep it cracked and mobilized so that you're pain free, which is great if you're talking, hey, let's just keep things moving. Like I think you said the other day, motion is lotion, and it's true. And that keeps everything moving. Everything's awesome. It's going to be less pain free if things aren't stuck. But I think we can do a little bit better if we're talking about actual health of the nervous system, especially when it comes to our kiddos and our babies. And what's funny, because a long time ago, I used to think, man, I'd like to help these people that need help. And kids, they run around, they're fussy, and they'll be fine. Come to find out, that's not the case. If I had to pick right now, adjusting adults or adjusting kiddos, it would be kiddos all day long. Because think about how dysregulated some kiddos get in their nervous system and how bogged down and stuck. And then what we see all the time, colic, right? We see that all the time in our office. And I get so upset about this. I want to rip stumps out of the ground, flip over cars, because it becomes one of those things like, what is colic? And what we found is that probably the same thing y'all find. It's a lot of the times an answer that says we don't really know, but your baby's fussy, and I'll grow out of it though, or wait and see.
Yeah, no.
Right?
I mean, I had a baby that cried for 17 months, so that's my fourth one. So I'm extremely passionate about this topic. And I mean, as you know, Kim and I just wrote the book, Top 10 Ways to Raise a Thriving Baby Holistic and Naturally. That's why we're investigating this. What else are we missing? Right. And you got me worked up too. Because, I mean, Dr. Nadeau and I have always said what you do in the first 12 months sets the stage for life. Mm-hmm. I mean, if we can have them healthy, we don't put a lot of interventions on them. They get good food, good nourishment, the right floor time. That first 12 months, they can be healthy forever. Mm-hmm. Be the smartest, the most coordinated. So I'm passionate about that too. Let's help the babies.
Absolutely. So that book that y'all just finished, freaking amazing, by the way. So many good tips that I wish all parents knew, every one of those tips and the details for it. And then there's not only the links that are in there, but all the little tiny attention to detail that especially if you're a new parent, you don't know.
It's all the things I didn't know. Sadly, y'all are going to be like, you didn't know that? I didn't realize the amount of floor time needed.
Right.
We digress. But yes, please get the book. You'll find a lot of good information in there and the links to the videos of how to do these things.
And like you said, the first 12 months is so important because the way that the nervous system, once baby, not only growing in utero, but once baby's born, there are certain, I don't know if you want to call it mile markers that from 0 to 3 months, then to 6 months to 12 months, certain things are formed in the nervous system. And we always talk about nerves that fire together, wire together. And if they're wired together appropriately, they're firing on all cylinders. They just have a much higher potential than setting the stage for the rest of their life because you can't go back and redo that.
It's really, really hard to do that.
Mm-hmm. Fortunately, what we have found is that way back in the day, we thought what you were born with is what you get. And so now we know that the brain is more plastic. The nervous system can change.
Oh, yes.
Which is game changing.
Even in school, only 10, 15 years ago, they were like, well, once the neuron's dead, it's dead. It's too bad. Mm-hmm. I don't believe that.
No chance. So that neuroplasticity can change, and those neurons, those nerves, they can rewire, they can fire differently. It takes some work, but what if you did it from the beginning for those first 12 months? You did these little simple things that are just going to increase the nervous system's potential, and then you're setting the stage over those first 12 months, not only just for the milestones they're going to hit, but for their immune system, which is so closely integrated with that nervous system. Remember, the nervous system controls everything. And it's going to be coordination issues. It's going to be muscle memory. It's going to be actual memory. There's going to be so many different things that if we can get those going initially, just setting up the baby's nervous system for success. And that's what we look for in our kiddos. Our youngest patient has been a few hours old. We do see elderly all ages of life. Our oldest patient's been 96, I think. But sometimes people circle all the way back around. I'll just keep rambling if you let me go. So all the way back around, why would you get your baby adjusted?
Yeah, that's where I was going to go. We didn't maybe even used to need that, but the way babies are born, the actual birth process, in a lot of cases is a hot mess.
So what we found, and y'all know this too, just it's exciting to be able to tell people this, is that the main reason to have your nervous system adjusted and checked, especially by a neurotonal chiropractor, is because of stress. Stress is going to lead to things getting stuck in the body and in the nervous system. When things get stuck, now the messages that are supposed to be sent to the brain get confused, stuck, bogged down, and the brain can't process it like it's supposed to be doing. Baby's job, eat, sleep, poop, move a little bit. That's it. So the entire time that's going on, their nervous system is just feeding the vital organs just to make sure that it's healthy, that it can survive. and we don't realize what kind of stress that the baby's under, even in utero. Some really cool research, and again, we're complete dorks at the office. We love this kind of stuff. There's cool research that says stress that mom is under gets passed down to baby, and what we've even found is stress that grandma's under gets passed down genetically. So baby can be born with that gas pedal just stuck on, and that's so important to realize, because we talk about two main parts of the nervous system: your sympathetic and parasympathetic nervous system. We just call it a gas pedal and a brake pedal. You get that gas pedal stuck on in that nervous system. It's like running your entire life running from a bear.
Right. Fight or flight all the time. I say it's running from a tiger. It's real hard to focus on a math worksheet or anything, really, if the tiger's chasing you. So, but let's go back to the way they're born, either the stress in utero or what you were saying about just how even C-section babies kind of have to be torqued and cranked and pulled out, or even laying down in labor and how that changes.
So all of that.
What are you fixing at the beginning?
Before we even get to baby's first few weeks, the birthing process itself, think about it like this. A couple quick things. We used to give birth, historically,
the ladies, the mamas.
Right. Way back in the day, hunter-gatherer type lifestyle, they would get up on a couple blocks and do a squat, catch the baby coming down, upside down, and they'd let that cord go and pulsate, get all the good nutrients that it's supposed to get. It's just going right on mama. Everything's soothing and nurturing, and it's great. Now what we're doing, a lot of times, we take gravity out of the situation. We put mom on her back. Then we get stuff like epidurals and Pitocin and all that stuff kind of going on, which if you have that, fine. But now we're taking some of that innate intelligence of the body out of it, which is going to create a little more difficulty for knowing when to push. Now
you're hijacking the natural process.
That's what it is. So that leads to interventions. Interventions like forceps or vacuum or C-section or having to manually flip the baby, doing whatever it is. Just the C-section alone, I don't know how many people actually watch C-sections. It'd be kind of weird if everybody was like, yeah, I've seen ton of those. Yeah,
the mamas haven't really. They put the sheet up, but we endure it.
But there's an efficient way to get baby out for the C-section. You've got to distract a little bit. Got to rotate and laterally flex. And let me show you this real quick. For anybody that's actually being able to see this live or during the recording, the occiput, the skull, and C1 are kind of cemented together. C2 has more direct attachments of the spinal cord to it than any other section in the entire spine. So when we have to pull, C1 and C2 they separate a little bit. So not only are we distracting, or having to rotate and laterally flex to get baby out, which is the most efficient way during a C-section to do that. But now we're stuck with this, which is why on a C-section baby, we find C2 needing attention almost every single time.
And that is not just uncomfortable for baby, but you're explaining today that it's hijacking the nervous system too, and could lead to the poor sleep, the fussiness, the feeding issues.
Absolutely.
Just having had their little delicate neck.
That's right. So now all of a sudden we have something wedged and shifted. I mean, imagine taking a rubber band and stretching it so much that it just doesn't go back together, right? It's going to be worn out. It's going to be stretched. There's going to be something going on there. Fortunately, not the exact same with baby, but as we distract, laterally flex, rotate, and pull, we are having some issues just in the spinal cord and with the neurology in that area of the spine. And that area of the spine, right at C2, is right where the nerves are coming up, crossing over, and then entering into the brain. So we're going to end up with extra issues there. Like I said, I bet 99% of the time we find that. And it's not just an uncomfort or discomfort thing, but now the nervous system, which is trying to communicate and relay information into the brain, can't fully get that information in because it gets blocked. We call them roadblocks or subluxations. Now the baby becomes fussy because the nervous system is overwhelmed. It can't focus on what it needs to focus on clearly, and we end up with fussy babies or colicky babies. And what we find is that if that doesn't get corrected, babies don't often just grow out of colic or grow out of being fussy. They grow into other disorders like autoimmune stuff. They grow into asthma, allergies, autism, ADHD, neurodevelopmental focus issues, digestive issues, sensory processing disorders.
No, it's a perfect storm because you add aluminum to that little twisted system, and then you're really going to exponentiate the problem.
And we talk about it a lot, that it is the perfect storms. We talk about a lot of times how are our kids getting sicker and sicker year after year, generation after generation. We're having more sicker kids than ever before. Why? And I think if we go back to that root cause, which is a lot of the times, I think we both agreed on this before, a lot of times someone won't dig deep enough to find out what's actually causing or what that root cause is. But we have to remember, if the central nervous system controls every single part of the body, and that's on fire, just that gas pedal stuck on, stressed out, we're going to end up with those problems. You're not going to be able to breathe like you normally should. You're going to end up with asthma and allergies. You're going to end up with focus issues, with ADHD problems. You're going to end up with, like you said, you add that aluminum from those different things. You get little toxins and little problems and little stressors, all different chemical, physical, and emotional stressors all going on. That is the perfect storm to create sickness and just breed a generation upon generation of sickness, because the nervous system doesn't know what to do. It's overwhelmed and bogged down.
So is it your thought really that every baby needs to be adjusted, or only if there was a difficult birth, or if they're having colic? I guess you're probably thinking, yeah, we should check them all.
Again, being complete geeks in our office, we're going to geek out on this. We were actually reading some research before where they took 100 quote unquote healthy delivered babies, no medical intervention, everything was natural, everything went really well, and they were checked not by a chiropractor, because it wasn't. I always think it's funny how someone who does the research also funded the research and then performed it themselves. So it was someone else who actually did the research. They found that 99 out of 100 babies checked had some sort of musculoskeletal abnormality between their skull and the upper cervical spine. So that's not me saying, hey, everybody needs to be adjusted. That's me saying, I think everybody should be checked. If you have one master controller of the body, and this research says 99 out of 100 had some sort of abnormalities after a healthy birth, we should at least check them.
And we should do it for our babies, because again, the first 12 months of life sets you up for success forever.
Oh man, so much.
Okay.
And real quick, a lot of times people might think, well, how do you know? How do you check? We have a couple neuro scans that we can do for our patients, especially the babies, even 1 day old. We measure their heart rate variability. We have a little clip that we can put on their finger or on the ear. It's going to measure the heart rate variability, which is just how well the body is adapting to stress or to life. So it lets us know, hey, is the baby's nervous system under stress, or is it fine? And then we also do a thermography assessment where we just roll something up the spine, and it takes a recording bilaterally all the way up the baby's spine, checking bilateral skin temperature, which is just a real measurement of balance of the gas pedal and brake pedal. So it's not, hey, bring your baby in, let's adjust them. It's, let's bring your baby in and check. Let's do something objective where we can measure, and if they need treatment, let's go ahead and adjust them. Which babies adjust, we can get into that, but if it's a manual adjustment for a baby, it's like feeling the ripeness of a tomato or an avocado. That's about the amount of pressure. But then we can remeasure and see, because it's an actual science, right? If we can measure something, we treat, and then we remeasure, we can see if we're making a difference or not. And we always talk about hard signs and soft signs. Y'all probably do the same thing. Hard signs are, can we measure something and change it? Soft signs meaning, are you, mom, dad, are you seeing a difference in your kiddo? Do they seem healthier? Are they less fussy? Are they sleeping better? Are they eating better? Are they latching better? Or is digestion going okay? So there are hard signs and soft signs that we really do need to keep track of both to see that we're progressing in the right direction.
Okay. So it sounds like if they can get to a chiropractor, that's advised. Now, say everybody can't come to you in Plano.
Sure.
What are moms to do? How do they know who is trustworthy with their baby?
Well, first thing I would recommend is getting on a plane and coming to see us. But realistically, we do have a website. It's not ours. It's pxdocs.com. And you can go to that website and find any neurotonal chiropractor around the country. There are even a bunch of chiropractors in other countries. So if you punch in your zip code, it'll take you right to where a place that's going to treat you right, that's going to do things the right way, that's going to be able to check and evaluate your entire family, but especially the babies and the kiddos for any neurotonal distress that's going on. So like you said, if you're not located in Plano, or sometimes we get asked, you know what, I just can't make it, there's too far. Well, let's check out the website, see if we can't get you some help, because it's not about just us. It's about, hey, let's get help to all the kiddos and the babies, especially in those first 12 months. So we set them up for success and hopefully have a healthier nervous system, healthier life moving forward. So I would definitely urge anyone to check that out if you have any questions or comments about where to look for a neurotonal chiropractor.
So for a newborn or a very young baby, you talked about doing a scan. What does an adjustment look like for a little baby? I know you said light pressure. Now I did see you hold baby upside down, so I wanted you to tell us a little bit about that.
Okay, I was wondering if that was going to come up or not. Good. So if we've reached that certain comfort level with mom, and we're walking her through the entire adjustment. Remember, back in the day, women used to give birth standing up, babies coming out head down, right?
Right.
So when we were checking the other day, when I was checking, brand new baby, we've already done our scans. We did a skin check or skin temperature check side to side, just to double and triple confirm what needs to be adjusted. What we'll do is, the technique is we'll hold baby upside down real slightly, and the nervous system is going to start to flow and send messages. It's going to be a little less stressed, and the reason it's going to be less stressed is because the contorting that baby had to go through during the delivery, whether it's the birthing canal or whether it's C-section, whatever it is, there's going to be something, or there could be something that is stuck or is not moving appropriately. So what we want to do is check baby upside down like this, swaying back and forth in the upper cervical region, swaying back and forth with light pressure. Again, already checking and triple checking which side actually does need adjusted. Swaying back and forth is going to allow that neurology to flow evenly back and forth while we're gently placing that upper cervical region back into alignment. Here's the catch, moms and dads, baby's not going to like it at first, and they're going to tell you. So as they start to cry, it's completely normal. They're just starting to go, what's going on? What's happening? And one of two things will happen. We get everything situated like it needs to, and they'll stop crying, which is what happened the other day. Still upside down, baby, just that nervous system just.
It's a reset.
It's what it is. That's probably the word. That's the best word that we could use there. And they either stop crying then, and that's just a telltale sign, nervous system's reset right there. Or from there, once it is reset, we're going to take baby, flip them back, cradle them, getting them real close to you, and we're going to flex at the hips and at the legs. That's really just baby's, it's helping. What that's doing is stimulating the brake pedal of the nervous system. And that, if baby doesn't stop crying while upside down, once those lower limbs get flexed forward, that will stimulate that brake pedal, that parasympathetic nervous system, and the baby will stop crying. That happens all the time.
Hold on, this sounds like something that we all need to know.
So let me back up.
So just pulling the legs up is also another.
So here's what we're going to do. I'm
trigger for baby to calm down.
Just nice and easy. He's already slept anyway. Think about an animal like a cat, or you can think about a human being. Either one. It's funny. You can watch this. When you're going to sleep at night and you're trying to get comfy, you're in this cradle position.
Right.
It just automatically stimulates that parasympathetic nervous system, that brake pedal. It will reset it right there. And then in the morning, guess what happens? And cats will do it when they wake up in the morning. You and I do it when we're getting out of bed. We're just like, oh, that good stretch. It's that innate intelligence of the body stimulating the sympathetic nervous system, saying, hey, it's time to get up. It's time to go to work. It's time to do that.
A little baby that's swaddled in a little burrito and on their back has no chance to do that.
You are completely taking away that brake pedal for that baby. They're just stuck. And if it's in that position, just swaddled. And the tough part is this. They're so cute and swaddled, and it's like, oh, let's just swaddle them up. It's so nice, and it's so comfy, and it's so cute, and it's amazing. What we don't realize is happening, we are forcing the baby to stay stuck with that sympathetic gas pedal stuck on.
If we let them on their tummy and they can pull their legs up under them.
And you notice they do that all the time.
I hate that we took that away.
We did it a long time ago, and all it takes is awareness, because we get told the wrong thing by people who don't really know sometimes, which is why crawling got taken out.
I know. It's in the big book, y'all. You're not going to believe the research I did on milestones, and they did take crawling out. So, yes, it's coming. The information, y'all. It's
needed. So, yeah.
Messed up.
Babies crying, a lot of the times, get them into the hunched over position. Take those hips and those lower extremities and just flex them into your body, into the baby's own body, and it's going to help stimulate that brake pedal a little bit. It will naturally calm down that nervous system. Is it going to work every single time? No, because maybe the baby's just bad. Maybe they're hungry. Maybe they got, and no amount of relaxation is going to fix hunger. But if it's a nervous system that needs calming, help the nervous system calm just a little bit by allowing that natural brake pedal of the body to take over and be stimulated and help reset a little bit.
And knowing the importance of the vestibular stimulation anyway, I mean, is there any reason why parents wouldn't want to hold their own baby upside down? What's the catch?
Here's the catch is,
I mean, our son loved it. He always wanted to be upside down, so it's probably playing into.
Sure. I guess the only catch would be obviously safety, but making sure that moms and dads, you're not messing with the neck.
No, yeah. No, I'm just saying hold them by the feet and let their body calm down.
Yes. Yeah. And they'll do that. And again, you'll know if it works because they'll stop fussing. They're going to fuss right away. But once that reset kicks in, it'll be like, oh, was that magic? What just happened? No, their nervous system just got a breather, and it's nice. They're able to relax and calm down now. They're probably going to take a great nap after that.
Okay, both really good tips. Pulling the legs under, holding them upside down. We kind of digressed from the point, but
sure.
That is an excellent tip for moms, so thank you. For dads, too. Maybe dad and mom there together to do that safely.
That's true. Dad, you're not out of this. Mom's dad, you have freaked out nervous systems too. I mean, just
hang me upside down.
Right. It's I'm about to get one of those devices that you can just hop up and up. Then I might not be able to come. You know what? I'm not going to do that. I'm just going to keep getting my adjustments. Mom's dad, get your adjustments.
Yes. Okay. So we have a lot more to talk about, but some questions in the chat. Okay. One of you has been bringing the baby since they were born. And when do they get to stop going is what she's asking. Like how are you supposed to go every week forever?
Good question. I get asked this by parents all the time as far as just themselves or their kiddos. There are a couple different ways to look at this. One is going to be, we have to remember what causes baby or mom and dad to need adjusted anyway. Remember, stress.
Mm-hmm.
So I tell people this, and we don't twist arms because we love what we do. I think it's amazing. And the last thing I want to do is have to argue with someone about should they come or not. If stress, physical, chemical, and emotional stress cause the nervous system to have that gas pedal stuck on and wreak havoc throughout the nervous system, when was the last time you, Christine, went one day without any stress?
Oh, yeah.
Right? Right? So here's the thing.
Almost 50 years to go, Jason, but I'm not going to tell anybody how long exactly.
So here's the thing when it comes to that is, ideally, yeah, you're getting checked every week. Do you need that? No.
But focus on the first 12 months. And if your kiddo is playing in the dirt, eating healthy food, getting sunshine, I mean, all the things we talk about at Shine, they're not in so much of a mess. They're grounding. And
isn't that one thing that we're missing out on now, playing in the dirt, getting dirty, rubbing,
I
eating
love it.
dirt, all that kind of stuff. You remember like being a kid running around, your parents would kick you out of the house. Don't come back till it's dark and you're playing in the mud and in the dirt.
Yeah, they don't get to do that anymore.
No. But anyway, so just to finish answering that question, so whoever asked that is satisfied with his answer. One of the ways that we check is our neuro scans. Bringing that baby in, we're going to scan again. We're not going to just check originally and then never check again. So we're going to check how the nervous system's doing, what's under distress, what parts of the nervous system actually need attention, address those, and we'll retest. And if everything is going well, if that pattern is changing, if that nervous system is better regulated, great, let's back off care a little bit. But you know what we're going to do later is retest the nervous system again. Because if everything continues to change and go well, then let's back off a little more. So there's a rhyme and a reason to it, which is why I was suggesting a neurotonal chiropractor that's going to actually test that. And not just say, is your baby fussy or not? Baby's not in pain. Well, we hope they're not in pain. But they don't have a way to tell you other than fussing, which is the same way they're going to tell you anything else in their life. So testing, I think, is one of the best ways to check and see, hey, do we need to keep coming back as consistently as we have been? We don't know if we don't check.
So people are still going to ask for more from that, but probably like once a week when they're below 12 months, and then once a quarter or something, just to make sure we don't have a problem. I mean, assuming that your child's healthy, of course, if they have anything else going on.
Right.
More often.
That's tough because there are some kiddos that we'll see a few months, 3 or 4 months old, and they're having digestive issues. They don't sleep. They don't latch. They were just tons of stuff going on, and we'll do a neuro scan on them and find out that their nervous system is just tanked. Their HRV, which again remembers how well the body's adapting to life and to stress, is just tanked. It's uneven. It's just not regulated at all. Their thermography scans are just blown up all over the place, especially in certain areas. They're going to need more care. They're going to need a couple visits a week for a while. Yeah. Whereas someone who comes in and we do our scans and their HRV is great, the thermo scan looks good, awesome. Come back in a few weeks or a month, let's check again. And if everything's still going well, great. Let's extend that. I mean, we'll still check down the road, but you need much less care if we're able to scan objectively and see what the differences are. But again, everybody's different. Everybody's baby is the same. Different. The delivery process is different. What mom went through when she was pregnant there's so many variables to that, which is why we have to take a deep enough dive into the history and the pregnancy and the delivery.
Okay. So do you have a favorite baby story? Or I guess any patient, but we're talking about babies here. So sure. Anybody just come to mind?
It's kind of a mix between some of the kiddos that are having all kinds of stuff going on, and to see them freak out in the office. They're just crying, they're uncomfortable, and they're just nervous system dysregulated. They're having all these issues going on, and then to see them down the road cuddle up with you because their nervous system is relaxed. Mom is telling us, hey, their digestion is great, they're latching better, all that. Those are just great. It's more funny when mom says, baby hasn't pooped in a week. And then before they get home, they send our office a text message going, well, that problem is better.
Instant resolution.
Right. So it kind of goes back. We got different stories that we could talk about for days, whether it's someone that comes in after they're a few years old and having something going on, or whether it's a baby that was just born and they're going through some struggles and then it gets better. And it's just so nice when they're snuggled up. And who doesn't like holding it like this baby? You almost don't want to give it back to mom. You're like, sorry, mom, I just you need to take a nap anyway. Just hop on the table. We got baby for a little bit. So that kind of stuff is just really cool to do.
Excellent. Okay, we have a question in the chat about just briefly what is the neuroscan. So are you talking about the one that you roll up the back? Is that measuring temperature?
Yes. So the one that we're rolling up the back is 2 little prongs. It's a device, and it's called CLA, or Insight CLA. We roll up baby's back, and all it's doing is recording the temperature. Now, you think about it like this. If you're measuring 2 different spots, it should be relatively the same if it's that close, right? Right. So if we're rolling this up baby's back, and all it's doing is recording the heat that's coming off of the skin, it should be relatively the same temperature. When it shows up and one side is way hotter or way colder, then it just gives us different diagrams and different bars, different colors, all of that shows up. Oh, C2, there's a huge red bar here that tells us it's way hotter on this side than this side. You know, this transition zone, which is important to check on every baby, really huge. You've got 2 or 3 red bars showing up right there. So it just tells us the imbalance. And again, the importance of that is the hot versus cold is the gas pedal, brake pedal. So if we know we have an imbalance in that skin temperature, we know that the nervous system is imbalanced right there. You don't want to go getting a Ferrari driving down the freeway going 100 miles an hour and then go, oh crap, we don't have a brake pedal. Right?
No.
Might start fun to begin with if you're an adrenaline junkie. Come on now. That's not going to end well. And that's baby's nervous system. If we're rolling up and all of a sudden we got something that is just light, just so much warmer and so much colder, we know that we're having a brake pedal, gas pedal issue right there. So that's what that thermography tests for. And then the heart rate variability, we either just clip on baby's finger, and it's a 3-minute test. It just records what it needs to record as far as the adaptability, the balance, the skin temperature, that kind of stuff. Or we can clip right on baby's ear. Same thing, 3 minutes. Usually mom just holds baby, just kind of relaxed. And then after the 3 minutes, it'll give us all the data that we need to see how baby's nervous system is adapting. Yeah.
That's good. This sounds like it's important for raising a thriving baby to make sure there's not a glitch there.
Right, and that's what it's all about. Is just let's do the best that we can for our babies, so that the nervous system, again, master controller of the entire body. Let's see if that's working the best. Then we can get the heck out of the way. As a neurotonal chiropractor, are there other things to do? Absolutely. Like I said, every single thing you put in that book. I couldn't write enough about when I was going, hey, look, this is
awesome.
Amazing. People
put an Amazon review for me.
Oh man, I've got to do that.
Okay, well, did we talk about if they can't come to you and they can go to another, yes, where you went to the website, but also if they're just going to they don't have a neurotonal chiropractor, it's a regular chiropractor.
Right.
That's still probably better knowing that they just had their neck torqued or whatever, but I guess those doctors are guessing on, is that what you're saying? Without that test, it's imprecise?
I'm saying that without a way to objectively test and measure, it's very difficult to be able to record and measure what you're doing. And science, right? You got to test something. You got to do something. You got to retest it. But if you don't have a way to measure or to test, it might be difficult to trust that, hey, this person is really skilled and really experienced and really great at this. It might be great at something else. And one thing we get from patients, they say, well, we're moving, or we have family members, you know what, we found this chiropractor. How do we know that they're
trustworthy?
Right. And the answer really is, I don't really know. But one thing we do recommend is that we not only call them, but check on their social media. Check on their website. If you don't see babies anywhere on there, there's a good chance that they're not seeing a lot of those. And maybe, like I said, maybe they're great at the other stuff, but if all you see is equipment and adults, and they're saying, yeah, we specialize in babies, I would go, I don't see any babies. So that's something that I would probably check for. Do some of the Google reviews. I would check, again, their website, their social media, the YouTube, stuff like that to see, hey, are they actually talking about babies? Can you see them, babies in their office? That's something I would look for.
Excellent. Okay. If mom were to get adjusted while she's pregnant, does that make the baby better off coming out?
Oh, goodness.
I guess less stress.
Sure. Now, we could spend an entire at least hour on this.
Just give me the highlights on chiropractic during pregnancy. There's a special certification, right?
Absolutely. So we are Webster certified. It's a very specific technique for pregnant women that helps with the bones, the muscles, the ligaments. We want everything as mom's body is growing and changing and relaxing, hopefully.
Okay.
To do so, but we want it to be balanced. One hip is rotating and allowing for extra room for baby to grow. The other one is stuck. Well, that's not good. We want the environment for baby to be the best that it possibly can, so baby can move where it needs to. It can rotate where it needs to. And when it comes time for baby to join the world, it works as smooth as possible. So yes, there are techniques for that. There's a technique, the Webster technique for that. But also, you want mom's body, her nervous system working well. Because again, all the stress that mom has, even if it's just physical stress, baby gets that as well. Everything mom gets, baby gets. So
I read somewhere that like being bathed in cortisol was almost as bad as consuming alcohol for the baby. It's just so hard on their brains.
Everything mom gets or experiences, baby gets.
Yeah.
Everything. So one of the best things is that.
So grounding too, y'all. Lower your cortisol.
Seriously.
We go to the chiropractor.
We keep talking
Lay in
about
the sun.
Yeah, keep talking about having a barefoot day at the office. We're gonna go outside. We're gonna just everybody outside. Take your shoes off, relax, just do some grounding, hop on the table, get adjusted. It's amazing. But we want mom's body to be relaxed too. If mom's body is more relaxed, if their nervous system is more relaxed, baby's gonna be more relaxed.
Okay, good tips.
Mm-hmm.
Anything else you can think of that we haven't covered? Anybody have any questions?
Once I get going like this, I forget what I even said.
I think we covered it. I mean, it's important.
Yeah.
We don't want babies to, you know, I mean, just in layman's say, their neck to be stuck, and that makes their adrenaline excess even worse.
Yeah. Stuff like torticollis, when baby's head is rotated, they won't turn to one side, they'll only feed on one side. That is such a neurotonal dysregulated nervous system issue. And what we find all the time is that we're going to try to massage it or stretch it, and all that stuff is great. But we know that there's a neural component to that. So it can be anything from that, or like I said, respiratory problems, all that kind of stuff. We just want to do the best that we can to give baby's nervous system the best chance it has to reach its full God-given potential as it's growing, especially during those first 12 months.
Amen to that. And then I don't even know why I thought to bring this up, but the helmets. That's going to cause a problem too. We don't really believe in the helmets. I mean, that's essentially the plates are stuck, and we're going to keep the brain from growing so that the plate that's stuck can catch up. I mean, the whole thought process is a little backwards. Do you ever address the skull, or do you have a technique or someone you refer to for that?
We do a lot of that kind of stuff in the office. The problem that we run into, maybe y'all run into as well. Oh, my insurance company's just going to pay for the helmet, and they're going to size it for us, and they're going to.
Well, people don't know it's keeping the brain from growing.
They don't. Here's what we found is that those bones, the cranial bones, are like little teeth, and during the delivery process, they can shift a little bit. If they're shifting a little bit, now brain is going to be sort of decreased, or it's just not going to have the room that it needs to expand, to grow, for everything to wire and fire together like it does. And at certain times, especially during the first 12 months, certain parts of the brain are going to grow differently, and then the other half of the brain is going to have to catch up. But if we're inhibiting that, because we're just not letting the brain grow like it needs to, yeah, we can end up with some issues down the road just because of those neurons, those synapses just aren't working like they're supposed to. Kind of the same thing like swaddling the baby. Don't limit what the baby's nervous system can do. Let it go. It's supposed to be doing those things.
So do you do any kind of cranial adjustments, or do you refer them out for that? Or?
We do some cranial adjustments in the office. We first check the nervous system, because if the nervous system from the skull down is dysregulated, then the information getting into the brain and circulating throughout the brain won't be efficient anyway. So we start here, and in addition, we do a little cranial work with just certain spots where those cranial bones do actually come together.
Right. The C-section babies especially don't get to pass through the birth canal and have them loosened, essentially.
I always forget about that part.
Stuck.
Yeah, that's true. Such a super important part, such an advantage of going through that birth canal is
one of many. But you go ahead. Yeah. That's what frees up those cranial plates.
Right. It gets them to go to work like they're supposed to, as opposed to now we're just kind of stuck. And it limits a little bit of that brain growth, or especially the brain balance. We see a lot of times kiddos in our office that have brain balance issues, and you can tell the right brain is not caught up to the left brain, or vice versa. So even kiddo down the road might be 2 years old, 5 years old, 10 years old, but the brain isn't necessarily that old. The brain can be limited and inhibited just a little bit because it's not able to grow to the full potential, or one side of the brain can't catch up to the other one.
Oh, how sad. Okay. So that's why we're here on Shepherd, is to just bring all of these ideas to light so that we can set these babies up to thrive. Thank you for being here. Does anybody have any more questions? Oh, I see one in the chat. What is the name of the book? Oh, the book, Top 10 Ways to Raise a Thriving Baby, Holistic and Naturally. So that's on Amazon. It's just a little e-guide, but the mega guide, the ultimate guide, is coming out in the next couple of weeks, where we'll talk about chiropractic and all the, if you were to really do everything for your baby.
Right.
And none of them are hard or expensive or complicated. It's just things that we don't realize, don't think about.
Just another thing I love about that ebook, it is so short, simple read. It's just real quick, real simple tips that you just might not think of. It's not some in-depth read that you get in one of those books that's like 80,000 pages. You're like, man, I'm never going to get to this. Quick read.
That's what Kim and I say. If you want more, there's literally books written on every one of the top 10, but we read the books and we put the summaries in there for you to highlight. So
perfect. It's like going to school and having to take a big exam, but somebody slipped you the Cliff Notes. You're like, oh, I'm just going to read this part of it.
Yeah.
Great.
Yeah. Awesome. Great. Okay, everybody. Well, thank you for being with us, and thank you for being with us.
Thank you for having me.
Appreciate you. All right, guys. Have a good day. Shine bright. You are loved.